Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. This is Christian Brindle, founder and owner of Christian Brindle Insurance Services, and every single week, me and my company bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Folks, as I talked to you about this was a pre-recorded episode, so forgive me for being a little bit in the past a little bit about this. But the day that this actually will come out, my office is reopened. We will be returning to our offices officially on Monday, the 4th, May 4th. Which was 2 days ago from the time that this episode will air. And we're very, very excited about it. We can't be more excited about it. In our home state of Utah, they've completely lightened restrictions because things have started to improve with the COVID-19 pandemic. Essentially, folks, one thing that, has been talked quite a bit about is telemedicine. And how is it going to be covered by Medicare? And we've gotten a lot of requests about it through email lately. We've gotten probably about 3 in the last week or so, asking us to do an episode about telehealth visits and how they're going to be covered by Medicare. Now, as things start to clear up, as things start to lessen, as worry starts to decrease, there is still going to be a tremendous amount of precaution that's placed as the country starts to reopen. It will not be exactly the same as it was before, at least not overnight. In my state here in Utah, they've allowed certain businesses to start reopening. Our office could have stayed open, but for the safety of my staff, for the safety of everybody involved, we decided it would just be best if we all worked from home and worked remotely and just took some time to isolate for the safety of everybody involved. But the businesses that have been allowed to open, at least here in Utah, have been restaurants, gyms, and a couple of other different kinds of businesses. But those are the 2 most notable ones. They have placed restrictions, and the restrictions are going to be different everywhere from state to state. But here in Utah, they've placed restrictions as far as, like the person that cleans your table can't be the person that's, is your server. Weird things like that, at least here in Utah. No more than 20 people at a time can be in a building. That's going to be interesting for gyms. And every single person needs to be wearing a face mask. In fact, I have my face mask all ready to go. We got a pretty good one. And I'll put it on just so you watching the YouTube video can see it. Because, of course, as you know, this podcast always goes on YouTube. If I can manage to get it on. So as you can hear, if you're listening, the mask muffles my voice quite a bit. So this is going to be a little bit interesting. Obviously, we're going to be wearing these masks out in public. And that's going to be a requirement. So things are going to be different for a little while. I think it's going to be a slow, gradual process to kind of get us back to where we were before. And what this ties into with the telehealth medicine topic that we're talking about today is this. We are going to see fairly often, I believe, more and more people are going to still want to use telemedicine visits instead of physically go to the doctor. Especially people on Medicare, because what do we know about this COVID-19 pandemic? People on Medicare are at risk. People on Medicare are probably more susceptible to it than probably anybody else. Of course, it also has to do with how good someone's health is and et cetera, but this is kind of scary. in that regard. We're not going to be going into homes anytime soon for us as agents. At least I don't think that we should. Probably for some time. You see, all of the experts that I have read about, and I could be mistaken about this, I'm not a doctor, I'm not a COVID-19 expert, folks. I know as much as you do about this pandemic, about this virus. But what I do know is that there's a lot of experts that have come out and said that we can probably expect a second wave of cases to open up as the country starts to open up. Because when people start leaving their houses and getting around each other again, the virus is expected to spread. I'm not saying that they shouldn't open up the country. It's a difficult situation. You're damned if you do and you're damned if you don't. If you open up the country, it's more at risk to spread, even though it's starting to kind of taper off a little bit. If you don't open up the country, the economy crashes. So what's the answer? What do you do? Well, I'm glad I'm not the person that needs to make that decision. Let me just put it that way. But we're going to see more and more people still prefer to use telemedicine visits until everything is completely back to normal. I don't think that's going to happen, at least in the near future. I don't think it will take as long as everybody else thinks, but I don't think it's going to be as quick as some others think. I think it's going to take some time. So let's talk about telemedicine visits, how it's covered by Medicare. I have to take a quick break, hear from this week's sponsor. I'll be back in segment 2, and we'll tell you exactly what you need to know about Medicare, Medicare Advantage plans, telemedicine, how it works, the whole 9 yards. Don't go anywhere. Welcome back, everybody. This is segment 2 of episode 190 of the Everything Medicare Podcast. Folks, a lot has transpired during this pandemic. My daughter Violet will be a year old pretty soon. In less than 2 weeks, as a matter of fact. My daughter Violet will be a year old on May 14th. And anybody that's been listening to the show for some time, I'm sure that you listened when she was born. You probably listened as, the year went on and I made mentions of her on the show. And I just can't believe, a year is already come and gone and where the time has gone and how much she's grown already. And I just wanted to just take just a second here and thank the audience for being here with me throughout this entire journey. The show is as much about me as it is about Medicare. And I think that, I try to tie my life into the whole Medicare topic that we're talking about. But, if this show was just specifically about Medicare, different topics, Medicare covers this, Medicare covers that, we'd be like all the other lame Medicare podcasts that exist. There's a reason why ours does so well. It's because we try to make it interesting. We try to put a spin on it that nobody else can possibly do. And I think we do a pretty good job at it, to be completely honest with you. I'd say, 1 out of every 100 listener, comes around every so often and they're like, well, Christian talks too much. Christian goes off on a tangent. Christian doesn't stay on topic. My response to those people is, you don't have to listen to me. There's plenty of other Medicare podcasts out there, but you're choosing to listen to this one. And I find out later that a lot of them still listen, even after they complain. So there must be something we're doing that they can't get somewhere else. But this show is as much about me as it is about Medicare. If people have such a problem with the format, they don't have to listen. There's plenty of other lame, watching wallpaper dry, boring Medicare podcasts out there. I can't get through an episode on most of these other shows. So sorry if I try to add a little pizzazz to the show, but it's just something that we do. Let's talk about telehealth. So basically, folks, with Medicare, this is kind of what is listed on Medicare.gov as far as telehealth. It's being covered under Medicare Part B services, and it's basically being treated as a doctor's appointment. There's two sides to this. So the first side is if you want to see your regular doctor, but your regular doctor isn't willing to see you in person, or you're not willing to see them, whatever the case might be, and they want to do some kind of virtual appointment with you. This is basically what Medicare said. Quote, due to the coronavirus COVID-19 public health emergency, doctors and other healthcare providers can use telehealth services to treat COVID-19 and for other medically necessary, reasonable purposes. From offices, hospitals, and places of residences like homes, nursing homes, and assisted living facilities as of March 6, 2020. Coinsurance and deductibles apply, though some healthcare providers are reducing or waiving the amount you pay for telehealth visits. If you have coverage through a Medicare Advantage plan, you won't have to pay out-of-pocket costs, called cost sharing, for COVID-19 tests. They may also have or offer more telehealth services than what was included in their approved 2020 benefits. To find out how much your test, item, or service will cost, talk to your telehealth doctor, blah, 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 right? So basically, a majority of things has come out and said that Medicare is going to cover, virtual visits with your regular doctor, and they're going to cover it exactly the way that they would have covered it as if you saw them in person. And a lot of doctors are waiving those out-of-pocket costs that you may have had to encumber. So that's basically what we're looking at there. Now, there are a lot of Medicare Advantage plans that offer things like Nurse Line and other services that allow you to basically, talk to a registered nurse or a licensed medical professional 24 hours a day, 7 days a week. Those have been ramped up by a lot of the Advantage carriers. Now, there are some services, I believe, that if, let's say, you don't have a doctor with original Medicare, you're able to contact Medicare and they can kind of get you in touch with a service that they've been using. So, what I've been told about this is if you contact 1-800-MEDICARE, they can give you more information about it. But there's a service that Medicare can provide in order to offer. They've partnered with some kind of company, and they're providing telehealth visits for Medicare beneficiaries that don't have a doctor that they can use, although most people would rather talk to their actual doctor. Let's take one more break, folks. Don't go anywhere. I'll be right back. In our third and final segment, I have some final thoughts I'd like to share with you on this and the telehealth visits. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me all the way to the end. I encourage you folks to check with your doctor's office and see if they're offering virtual visits. Just know it's going to be covered by Medicare. It's going to be covered by your Medicare Advantage plan if you have one. And it's something that I encourage you to do because I do believe that keeping your distance and avoiding unnecessary contact with the outside world is not going to be a bad thing, especially for people on Medicare as we kind of move forward with this. I think this is going to take a little more time to completely and efficiently go away. And it's not going to happen overnight, like I said at the beginning of the episode. I think that just know that the telehealth visits are going to be covered. I have yet to see a doctor's office that's not offering them to their clients and patients. I've even seen some that are doing FaceTime and Zoom calls and things like that. You can, it doesn't matter. And they'll still allow you to go in and see them personally if a telemedicine visit isn't going to be sufficient. And sometimes it's not. Sometimes they need to evaluate you in person. But just know that. Just know it's available, know it's efficient, and know it's something that you have options to use. Folks, as always, I really, really appreciate you giving us some time. If you missed the interview I did with Medicare Bob on Monday, I would encourage you to go back and listen to it. I think it was a very, very fantastic episode. It was a very long episode, probably the longest podcast episode we've ever done, probably about an hour and a half almost long. And Medicare Bob is a very, very well-known person. He has a very well-known YouTube channel, and he helps people all over the country with their Medicare plans, and he shared a lot of great insight for people on Medicare. So if you haven't listened to that episode, I encourage you to go back and listen to it. Thank you so much for taking the time. Thank you so much for listening. We'll be back with you with a full episode on Saturday. Take care.